So the reason I've put Sir's photo is because today I really want to salute this man, because he realized the importance of mental health in people living with type 1 diabetes from the beginning. He was one of the few people who involved a psychiatrist for treatment of type 1 diabetes from day one. Not a single education camp has happened without a psychiatrist in his organization. So I believe that living with type 1 diabetes is a journey of acceptance. It starts at diagnosis and then it never ends. At different phases of life, you're faced with different kinds of challenges and you have to accept and re-accept living with type 1 diabetes. So these are two very different scenarios. One, we have a young 4-year-old girl or 5-year-old girl, and in the other case you have an adult or a young adult or an 18-year-old male, female, whatever. The gender is not important here. The reaction in both the cases will be very different. Of course, the initial shock, I think we've heard it multiple times, that at diagnosis there is an initial shock and then you go through a teething phase, and once you learn, you accept. But in the girl's case, it is not the girl who needs to accept, it is her parents who need to accept. But in the young adult or the slightly older adolescent, young adult person, it is the person with diabetes who needs to accept it. And I always believe that if you've lived to remember a life without type 1 diabetes, it is probably twice as more difficult to accept it, because you know a life without it. And then now you're going to have to do all of these things. You were a carefree person, just you move out of the house with only your phone and your wallet. Nowadays, not even that, because you have GPay. And now you have type 1 diabetes and everything in your life has to be planned. So generally the diagnosis comes with lots and lots of anxiety for parents, and in the case of an older person, for themselves. They have anxiety related to longevity. How long will my daughter live? Will she die early? Will she able to live normally? Will she able to fit in the society? Will she be able to make friends? Will she or he be able to make friends? Will she or he be able to have a career? Will they be able to get married? Will they be able to have children? How will society perceive them? Will they be subjects of discrimination? Will they be stigmatized? Because no parent wants to see their child go through that. The impact is something that comes later on. And I think in India, we've repeatedly heard it, that there's a huge impact on finances. There is an impact in relationship. So the relationship between the parents. So the psychosocial health of the parent is equally important. The diagnosis of the child significantly impacts the relationship between the two parents. If they don't work as a team together, they start blaming each other, it's not going to help. The impact it has on their attitude toward their child. Restricting playtime, not allowing to play more than 1 hour, half an hour, repeatedly going down, trying to feed them to prevent hypoglycemia. So that is actually also a reflection of the psychosocial aspect. It's a reflection of the anxiety that the parent is facing. Forcing the child to study, that you need to have a career, you need to do well in life, you need to get good marks so that you can compensate for your type 1 diabetes. The emotional well-being of the child as they are growing up, the emotional well-being of the parent, and of course, the biggest impact that the psychosocial health will eventually have is on the physical health. Type 1 diabetes is unlike any other chronic disease where you require constant management. You need to constantly think about what you're doing, what you're eating, what your sugar is, how much insulin, how much to take, how much not to take, how much to reduce. And if your mind is not right, you're not going to be able to do it. It requires significant cognitive involvement. It requires you to be in a stable state of mind to be able to take a well-informed, maybe as close as accurate decision as possible. So if your mental health is not okay, the first thing to get affected is your glycemic control. And if that poor mental health stays for longer periods of time, it is going to eventually affect your physical health. And you may, by the age of 25, 30, develop severe complications, which is going to worsen the mental health. So this is the cycle of acceptance. Whenever you get diagnosed, the first thing that any person goes through is denial. They'll deny. हमको तो है ही नहीं. हम नहीं देंगे insulin. Okay? Then comes anger and aggression. So they will be angry at, who will they be angry at? The doctor. आपको हमको इंसुलिन पे डालना है. They don't know कहाँ हम एक्सप्रेस करें. They'll be angry at the doctor. They'll be angry at the educator telling them कि आपको 6 बार दिन में शुगर्स चेक करने हैं. They'll be, angry at whoever they can find. They'll be angry at another peer who's trying to support them. The child will be angry at the parents, that it's because of you that I have this condition. After anger comes depression. Okay, and after depression comes bargaining. This is the stage when they will start bargaining. They'll go to all kinds of quacks. कि हाँ थोड़ा सा इंसुलिन कम कर देते, हम ये डाइट करते हैं, इंसुलिन कम हो जाएगा, धीरे धीरे शायद बंद हो जाएगा. So this is the most dangerous state. And then finally, they'll accept it. Now, it is not necessary that they will go to the stage of acceptance. If they remain in the stage of denial for years together, and then later go into the stage of acceptance, what will get affected? Physical health. They'll start developing complications, height will be stunted, and then it's next to impossible to accept it. They may remain angry. This is very true with teenagers. They are so angry. They are so angry. You try everything. And that teenager becomes an adult, and then he comes and shows you his A1C and he tells you, doctor, now I want to bring my sugars down. Okay, but those 5 years of damage, whereas A1C was double digit, is not going to be reversed, unfortunately. Depression, luckily, can be treated. We have medications. We don't have any medication for anger. And bargaining is where all the quacks take advantage. Okay. Now this girl or person with type 1 diabetes has grown up. Now they've become an adolescent. They've accepted their diabetes. She's living well with it. She's doing everything she has to do. But now she faces new challenges. All of her peers are worrying about boys. They are worrying about how they are growing. They are worrying about how they look. They are learning makeup techniques. But this person is struggling with deciding what to eat, what not to eat. Can I go out alone with my friends? How do I take injection in front of other people? How can I make an excuse so that I have some privacy to go and take injection? How do I tell my friends that I cannot make extempo plans with you guys? I need to plan my outings according to my diabetes. This is the time when they are at a very high risk of developing any kind of psychiatric issues, especially depression, and they are at a very high risk of developing eating disorders. There's significant diabetes-related distress, and I think teenage anyways is a very, very difficult age. It also impacts your blood sugar control. And if you mix in poor psychosocial health, that will be even worse. Especially if their relationship within the family is affected, then it can have a huge impact. This is the age when they start realizing that I am different from society. Till now, they were protected by parents, protected by family, but now they've started thinking about themselves. They're starting becoming a person of their own. And they again need to go through the cycle of acceptance. Now, it is not necessarily that they will reach acceptance. They may remain in anger, they may remain in depression for years to come. Finally, she grows up. Now they're entering adulthood. And young adulthood is a very, very challenging time, because this is the time when you're looking out for your career and you're looking out for a partner in marriage. And when you are repeatedly rejected by society, your own acceptance dwindles. So there are times you may have to re-accept your condition multiple times in a year. January, you had a proposal rejected. March, you went for a job interview, rejected. And every time you face a rejection, it may not be because of the diabetes, but somewhere at the back of your mind, you always wonder that, is it because of this? Am I not enough? Everything that I've worked towards in my entire life is just not enough because of this one condition. It just boils down to this, is that what it is? And then you start, at this age, you start realizing about the impact diabetes may have on your health. So you start worrying about complications, because you've seen older peers, they've started developing issues, and you start worrying about your own health. So you start developing anxieties. And a lot of double diabetes that we see is usually around this age group. When you start working, you have no time to look after your health. You're working 12 hours at a job. Food is all over the place. So this is one of the most challenging periods, and most of the times they develop double diabetes or metabolic health issues. Okay, you get married, you have a family. Motherhood brings new challenges, motherhood or fatherhood, because now you're not only responsible for yourself, you're also responsible for the child. But I think motherhood is, so I'm being a little gender biased here, but motherhood is much more difficult, because you have to care for the child along with your own blood sugars, and there's always a tussle कि मैं उसका पहले देखूं कि अपना पहले देखूं. And postpartum depression is very, very common in this group, and that is why constant touch, constant peer support is very important. Of course, you again worry about your finances. You again worry about your relationship with your husband, because your husband or your spouse needs to understand your condition. You again worry about because your leisure activities change, your career goals change, and your emotional well-being is also affected. So you again go through the cycle of acceptance. And then comes middle age and old age. This age is where you may be facing burden of complications. This is the age where you see some of your colleagues, diabetic or non-diabetic, developing health issues. So you're really, really worried about your own health, and it comes with its own set of anxiety. Of course, you age a little faster considering the metabolic impact of type 1 diabetes. But now you've lived for type 1 diabetes for say 25-30 years, and now you start developing something called as hypo-unawareness. And hypo-unawareness is extremely scary to live with, because it significantly impacts your glycemic control. And every time you try to achieve a good control, you get severe hypoglycemia. So luckily we have a lot of devices now. We have a lot of technology in place. Not everybody, unfortunately, can afford it. So fear of hypoglycemia, I think, is one of the most difficult to address psychosocial aspect of type 1 diabetes. Only 2 episodes of severe hypoglycemia or 1 episode of severe hypoglycemia can impair or prevent you from achieving glycemic control. I've seen patients who wouldn't allow their sugar to go below 200 because they were so scared of hypoglycemia. Bedtime sugars, we let it be high. If my sugar is 150, I eat a snack. I don't want to get a nocturnal hypoglycemia. So again, you go through a cycle of acceptance. So as I said, living with type 1 diabetes is all about accepting, reaccepting, and reaccepting your diabetes and the new challenges you face at every stage. So when I was preparing for this talk, I asked a few of my peers that, is this what you go through? You know, tell me what you are experiencing. And one of them said, and I'm going to quote her, that I don't think I would have any anxiety in my life if I did not have type 1 diabetes. So I think anxiety is one of the commonest psychiatric issues that a lot of people with type 1 diabetes face. It may not always require treatment, but it does require counseling and it does require a little help. So what are the solutions? And what research, evidence, and experience has shown is empowering the patient can make a huge impact in terms of their mental health. So empowerment is the solution. Okay, family support unfortunately is not in our control. We try to educate the family, but if they come from a broken family, there's nothing much that you can do. Social support in terms of community. So we have a lot of people who come from different communities. Different communities have different approaches. Peer support is something that is being talked about, and we are seeing a lot of support groups happening all over the country. And peer support, I think, is one of the most foolproof ways to deal with psychosocial health in people with type 1 diabetes. And one thing which has really improved or helped psychosocial health is that the person is themselves involved in their own management. So active involvement in your own diabetes management can make a lot of difference. That is why even in children, we always encourage you to involve them as early as possible so they start learning how to take care of their diabetes, and that actually has a positive impact on the mental health of the child. Right, so this is one of our camps. Then this is our mental health team. We have Vaishali here, who's our counselor. And we have Dr. Manoj, who's our psychiatrist. So that's it. Thank you.